We are back with Dr. Jeff Harp from Highland Family Medicine for part 2 of our conversation about dementia and Alzheimer's disease. Doctor, last week in part 1 we talked about dementia and Alzheimer's disease specifically. Let's begin by reviewing some of what we discussed.
So dementia is basically the ability, the loss of ability to think clearly, and enough so that it interferes with daily functioning. And Alzheimer's is a subset of dementia. It comprises about 70% of dementia.
All right, let's talk about spotting Alzheimer's or dementia. How do we know if somebody who we love, a friend or a family member, might be suffering from either condition?
So basically, there are subtle and sometimes not so subtle signs that people are losing their ability to think clearly. A classic situation is a person who gets lost driving someplace they've driven every day for their whole life, so just can't find their way back. But also not remembering where one's left something in the house, which happens all the time, but really not being able to reconstruct where they've been. Exercising poor judgment, like perhaps not getting fully dressed, and changes in mood and personality, getting more irritable, or just doing things that are not normal for the person.
All right, so those are signs. What do we do if we begin to notice some of these signs or symptoms?
So the most important thing is to really bring this to the attention of one's primary care health clinician and start to discuss it. There are things that mimic dementia that are not dementia. For example, people who are depressed can look like they have dementia, but by treating their depression, the symptoms go away. Also, drug interactions, people who are on a lot of medicine, sometimes the medicines can cause symptoms like that, so a lot of these things can be reversed. And then if it turns out the person really does have dementia, it's important for the family to start to talk about that while the person's still able to participate in those conversations, to plan for what's going to happen eventually when they're not as able to participate in a conversation and make decisions for themselves.
All right, and again, we'll leave it there for part 2 of our conversation. Part 3 of our conversation, we'll talk a little bit more about the role of the physician as well as treatment options if you do make a diagnosis of either dementia or Alzheimer's. As always, we're sharing these conversations online. You'll find them all posted at rochesterfirst.com.